I somehow knew I was doing the right thing. I was like, you know what? I'm too young to give up. I don't want to give up anything in my life at this point, like playing sports and stuff like that. So we went in and I was fine up until the anesthesiologist came out and said hi to me, and I was like, okay. And that's when the tears kicked in and I started crying. But I was like, just push through, push through, push through. And the doctor came and he saw me, and this is when I knew I was making the right decision, because he sat down with me and he looked at me and he was like, you don't have to do this. Because what I was going in for was a surgery that was concerned with my everyday lifestyle. It wasn't something that I had to do. It was my choice. And when he looked at me and he said that, and my parents were there and they looked at me, and I was like, no, we're doing this. Like, I didn't come all this way. I didn't go through all of those weeks to come here and not do it. Like, I'm here, I'm doing it. So I did it. Leaving the hospital right now. This is where everything went in. And the first 3 to 4 days after the surgery were actual, like, I don't want to curse, but they were terrible, like terrible. And they prescribed me Oxycontin. Yes, that very, very powerful drug. And I did not take it. I know some of you are gonna be like, what? Like, you're insane. Like, how did you not take it? I didn't take it. I lived off of Advil and Tylenol, and I did it. I made it through because I did not want to take it. It was just a personal choice, and I don't know how. I honestly don't know how I made it through. The pain was excruciating. Like, surgical pain is so much worse than just injury pain. Like, I remember the pain that I don't remember it, but I know the pain I was in after the accident, and there's no way that it was even remotely similar to the pain that I felt after the surgery. The surgical pain was 10 times worse. It was terrible. Like, it was actually terrible. So I just woke up after the very first night of sleep, and it was rough. Not gonna lie, it was really rough. I had to stay in like one position, and I couldn't like roll onto my stomach or anything. Like, I had to stay on my back, and that was like the hardest part, because all I wanted to do was like curl up in a little ball on my side, and I couldn't. And oh my god, guys, like, my stomach, my neck, and my forearms, I feel like because I can't even do it. Look, I can't even get up. Like, I can't even sit up. I would have to call my mom right now if I wanted to sit up. But like, I sat up so many times, and I like had to lift my leg with my own arms. They hurt so bad. Like, I did like 50 pounds of like 100 curls on my forearm or something. Like, holy crap, in my whole chest. I can barely like even like breathe in and cough, but oh my god. Oh my god, I can't laugh. Holy crap. So I slept with this machine last night. It's the Game Ready one, and then I wore it underneath my brace, and it basically like goes on these interval times where it gets cold. So it's like an ice machine, and it's hooked up to this huge box right here. Hey guys, still day 1, still in pain. Not much more to report. I've been right here. Luckily, my brother came and played sorry with me, and he beat me. The worst part is like wanting to sleep on my side and just curl up, and I can't. And my butt, like, because I've been sitting on my butt for so long, it hurts. And I just want to put on makeup, but it's like all over there. And I feel bad. I keep making my family gets stuff for me. Oh my god, my neck hurts so bad. Hey guys, so I know I didn't check in like yesterday or anything. Sorry, I'm literally watching Fortnite videos. Okay, I have some amazing news. I saw the doctor yesterday for the first time since surgery, and I wanted to like film something like coming out of the office, but I was with my parents and it was kind of hectic. But it was basically my first checkup and it went amazingly. He said it looks amazing. He said he couldn't be happier with how it's healing, and it just really like put me at ease because up until that moment I hadn't really talked to him since the surgery, so I was kind of like in my own world with this like leg that wasn't moving and I didn't know like what to do. But he took it out of the brace completely down to my bare skin, so I saw it for the first time. Maybe I'll insert a picture, I don't know. And it actually does not look that bad. The cuts are like really tiny and it was my first time seeing it. The only thing is that it was like super swollen, and like to me I was like, that looks like so swollen, and he was like, no, like it looks so good, and I was like, okay. But I mean, I obviously trust him. He said it's looking good, so that made me feel much better. And I know that I was supposed to be like exercising it, so I've been using that red band and doing like foot flexes. But he actually wants me to try to start bending it, which is like extraordinarily painful, and we did it at the office. However, he wants me to do it like on my own, and I was in a lot of pain before I went to see him, but I think it was like nerves and anxiety and just anxiousness, and like once he started to move it did hurt, but him telling me that like no matter what, me bending it and everything is actually good for it, I can't really hurt it by doing that, made me feel a lot better and more comfortable. So now I just feel more comfortable with moving it around, which is what I'm supposed to be doing. And I'm seeing him again next week, and if all goes well, I should be starting physical therapy in 1 to 2-ish weeks, which is a good goal. So yeah, that's my checkup, and everything's going really well, so I'm super happy. Yeah, I will check in soon. Hey guys, what's up? I wanted to check in and get some nice footage right now because I just did my makeup and we're going out to dinner. The brace is right here. There's the brace and all comes out with me, obviously. What we do is basically we get like a second chair, and I'm basically 2 people, so I just put my foot up on the chair and it's, you know, good to go. So it is July 7th today. That means it's been 2 weeks and I'm doing pretty well, so I'm really happy. Everything's going really well. I'm almost at a 90-degree bend, and I'm starting physical therapy next week. Everything's looking really good and I'm happy and I'm feeling really well. No more pain. I don't need to take Advil anymore. I'm good and basically just, you know, getting around with the crutches and everything, and it's going really well. And my summer classes are almost over, and after that I'll be starting again for my senior year of college. So somehow I made it through, and once the surgical pain went away and I was able to like get up and move around and like actually do things, like walk from one room to the other room, like I was eating in bed, like I was able to go to the bathroom, but it was a nightmare. I was able to, but there was no way I was making it down the stairs to go downstairs to eat dinner with my family. Like that was just not happening. And what I was also very nervous about is the surgery that I had done. What they did is they put a cadaver's ligament or like muscle tissue into my knee. Also, I literally watched the entire surgery on YouTube, like weeks leading up to the surgery, because I'm just that person. Don't do that. I wouldn't recommend doing that, but I did it, and I don't know why. Basically, something that I also had to know going into the surgery is that whenever you get surgery, there's always a possibility of a follow-up surgery, which was also something that I had to like consider. And also, when you get a cadaver ligament put in you, that's a dead person's ligament, so there's a chance of infection. So that was something in the first couple of days that was very crucial, to make sure that there was no infection in my knee, to make sure that my knee accepted and didn't reject the ligament. So I had to go for a lot of follow-ups within the first like week or two, and everything's fine. It was accepted, and the cuts on my knee are very, very tiny. They looked really bad when I first saw everything. It was like really, really swollen, like bloody, just like blood stains. Like, it was kind of gross. The swelling went down, and right when I was able to get back into physical therapy, I was back at physical therapy, and I was determined. I was like, this time around, this is the last time around. Like, this is the last time I'm doing this. Like, I'm giving it my all, and we're gonna get back to 110%, because I will not accept anything less than that. I was also nervous about how the scars would look on my knee, but they did arthroscopic surgery, which means that they put a camera into your knee and they make really tiny incisions, and they can see everything they're doing from the camera, which is like, blows my mind. Like, I don't even know how they did what they did with like the tiny cuts that I have on my knee. Like, it's insane. But basically, I think they used to do like the entire cut on the back of the knee. So yeah, basically it's been 3 months now after the surgery, and I'm nowhere near done.